And now we are going into the controversies presented by Professor Inass Shaltout.
Let me give a very short presentation about challenges of gestational diabetes. 1 in 6 live births is affected by hyperglycemia during pregnancy, as said by the International Diabetes Federation. And gestational diabetes affects 3 to 10% of all pregnancies. No specific cause, but placental hormones can mediate insulin resistance. These hormones are cortisol, progesterone, human placental lactogen, prolactin, and estradiol. These are the risk factors for gestational diabetes. A previous diagnosis of gestational diabetes or prediabetes, impaired glucose tolerance, or impaired fasting glycemia. Family history of type 2 diabetes, especially in the first degree, ethnic backgrounds like African American and other different backgrounds, and overweight and obesity. Gestational diabetes, does it matter? Yes. These are the fetal complications: high birth weight or small for gestational age, macrosomia, hypoglycemia, dysmature baby, respiratory distress syndrome, birth defects, preeclampsia, and the mother in 50% can have permanent type 2 diabetes in the future. Babies may suffer from childhood obesity and type 2 diabetes later on. This is the postpartum sequelae for gestational diabetes. We should do 6 weeks after delivery, we should do 75 oral glucose tolerance tests to exclude an ongoing diabetes or gestational diabetes or an ongoing diabetes or impaired glucose tolerance. There is an opportunity to reduce the risk of type 2 diabetes or to screen for type 2 diabetes in these ladies. These are the recommendations for gestational diabetes. Women with a history of gestational diabetes should be screened regularly, at least every 3 years, for diabetes or for the presence of prediabetes. And those with history of gestational diabetes, they have found to be of high risk of prediabetes or diabetes in the future, and they should receive either intensive lifestyle modification or metformin to prevent the occurrence of permanent type 2 diabetes. Let me finish my presentation with Angelina Jolie. She got gestational diabetes and she received insulin during her pregnancy. And thank you very much.